Hi, Dan. I wanted to quickly connect with you and talk a lot about Paws for Patrick. But first, I'll introduce myself and then we can jump into all of the wonderful work that you guys do. My name is Audrey Grunst. I'm a licensed clinical social worker, CEO, and founder of Simply Be Counseling. And we have been working with Paws for Patrick for many years and have really enjoyed all of the services and relationships that we've built with you guys. Here at Simply Be, we have a PHP IOP program. It's an intensive program for adolescents. And once a week, we have the Pause for Patrick organization come in with our kids and spend an hour with them, making sure that they feel connected and that gives them an opportunity to have a different form of therapy. So that's what's been really wonderful about our relationship with Pause for Patrick and how we help our clients. Dan, can you introduce yourself and also share a little bit about the organization?
Sure. I'm Dan Maigler, and I'm a high school social worker, a therapist. I am the mental health advisor for Paws for Patrick. So I make a little podcast called Not Allowed to Die, where we talk about mental health challenges and treatment. And in full disclosure to the audience, I was a Simply Be enthusiast even before Paws for Patrick. So in my private practice, I would refer people to Simply Be because I love the work that you guys do over there. But Paws for Patrick is a nonprofit organization dedicated to bringing the love of animals to the people who need it the most, ideally young people. So Patrick Romer was one of my students, and unfortunately, in May of 2020, he died by suicide. And his family wanted to do something to try to help other people. And Patrick's greatest resiliency factor was his relationship with his dog, Cece. And unfortunately, he lost Cece the first day of his senior year of high school. And he never really recovered from or was able to find something to replace that bond, even though they tried with other animals and connections. So after Patrick died, his family said, what can we do to just help support other families? And they knew it had to be something with mental health and something with animals. And so now Paws for Patrick has helped people in all 50 states. So if a person 30 and younger might want to get an emotional support animal, if they adopt from a shelter, Paws for Patrick will help pay those fees, for those adoption fees. If they need an emotional support animal letter, they can go to the Paws for Patrick website and they'll connect them with a therapist who will write that letter for them. And if they need that letter for like living in different housing, we'll talk a little bit about how that works, that can help out with that. And they can even get a little money for training. Also in the Lake County area, Paws for Patrick has 30 therapy dog handlers who go visit places like Simply Be, schools, hospital programs, anything else like that. So that's more local, but nationally, we help people get the ESAs.
And one of the things that we always focus on in mental health is what is the evidence base? What is the support behind what we do? At Simply Be, we are evidence based, so we do look for things that are shown in research to be effective. And it kind of goes into my next question, which is what is the efficacy of the emotional support animal, and how do we know it works? What is mental health research, and what does the background say on it?
Yeah, I mean, we all want to believe that it works because everyone likes animals. Isn't that a great story that animals can help people? But fortunately, we're living in a time right now where some of the first research has been done. So Dr. Janet Oigerlach of the University of Toledo did a study where she partnered people and she had a control group and an experimental group, some that got animals and some that didn't. And they found that there was a significant impact from having emotional support animals in a person's dwelling in helping reduce the symptoms of both anxiety and depression. And they measured this in not only just the anecdotal evidence of what the people reported, but they also measured some of their hormonal response. So the people living with the animals, they had a decrease when they were interacting with their animal, a decrease in the stress hormone cortisol, and an increase in oxytocin, which is that bond and connection. And so they feel that when staring into, say, the eyes, making eye contact with a dog or cat, then people may actually have an increase in their oxytocin release, which is really awesome. Again, so that's really cool that we're seeing that there's a real statistical measurable effect, but particularly in what people are reporting. And it's not just in what they're reporting for lack of loneliness, depression, anxiety. It was actually kind of funny. One of the surprises of the research was that cats were actually slightly more effective than dogs in reducing depressive symptoms. So I think a lot of us think of dogs when we think of ESAs, but so we want to be open-minded to wherever the research leads us. In addition, though, again, it's this not just those impacts, but we know we're having an epidemic of loneliness. Surgeon generals have talked about it. We see it with so many people. And that ability to have an animal to come home to, it changes that feeling for people. In addition, what is my role? For so many people who are getting therapy, they feel like they're always the receiver of help. but it can change this feeling of who am I in a relationship to the world, that I have a sense of meaning and purpose because I'm caring for my animal. So we've seen a lot of those impacts from the research that have really changed people's dynamic and trajectory.
Yeah, I can definitely agree with that. I recently was working with a client and we were discussing reasons to live. And one of the reasons to live was to take care of their pet and thinking about their meaning of life and being a caregiver to something else was really, really important to them. And while they reported feeling very hopeless and having a sense that if I wasn't here, that would be okay. However, I am here and I'm not going to do anything to myself to make me gone. So there's a difference at times between feeling hopeless about the future, but having a reason to live and holding both at the same time. Yes, I'm hopeless about the future and I'm choosing to live because I have something to live for. And sometimes in mental health, it's not always perfect. It's not what we want to see. We want people to have joy, we want people to have purpose. But if there's hopelessness, but there's a purpose and a meaning, that gives us the time and the ability to continue making progress towards joy. And it gives us time and it gives us something to work off of as opposed to having no purpose, no meaning. I mean, that makes people more suicidal when they don't have purpose and meaning and they're hopeless. So we're not afraid of hopelessness. At Simply Be, we treat severe depression, severe eating disorders. We see hopelessness. And when we provide other ways to engage in the world, like through Paws for Patrick, it shows people, oh, maybe the future isn't always going to be this way because right now I feel good. And that's something that we've noticed when Paws for Patrick comes in, we get an hour of oxytocin, we get an hour of feel good, and then we see the rest of the afternoon going better. So if there's clients or people out in the world who want to access this, what are the services or first steps that you guys can help them with?
So yeah, the first thing they should do is just go to the website, pawsforpatrick.org, and then there'll be a button where they can click on to sort of get help. And they'll be directed to fill out a form, which is asking, okay, what kind of help do you need from us? Many people they already have an animal and they might just need help getting that letter because either the clinician that they're working with has never written an emotional support animal letter before, or they're not allowed to do it. Certain campus counseling centers. So we get a lot of referrals from Ohio State University or UCLA, where the clinician may want to help, but they're saying, okay, my boss says I'm not allowed to do this. So then, okay, we can just help with that. But if they're saying, I really do want to adopt an animal, but I just don't have the funding source, they would just put whatever their needs are there. And then someone from Paws for Patrick would follow up with them to make that connection.
And once they get the dog, or the pet, what do they do? What's a daily life? What does it look like for the owner and for the animal?
The great thing about ESAs is that that's totally individual to each person. An ESA does not require any treatment whatsoever, or training, I should say, to be effective. It's just existing in that person's space. So you could say, well, what's the difference between an ESA and a pet? And the answer is nothing really. So we could say, what's the difference between riding a bicycle for fun and riding a bicycle for exercise? Well, nothing really. You're exercising, but it's also having a benefit to you. So we don't need you can have a tarantula, you can have a lizard, you can have a fish. It's really about, is the presence of that animal making you feel better, giving you that sense of meaning and purpose? And so as long as it's doing that, it's doing its job. Now, for some people, they may work with their clinician to say, let's say you're having anxiety and panic attacks and you do have this cat. Well, does stroking your cat, does it help to slow your heart rate? Because that really helps for a lot of people. If you're having insomnia, is it helpful if your dog is in your bed with you to just kind of know that there's another presence there? So sometimes clinicians, we can help people who already have that relationship and that connection with an animal to say, how else, knowing the symptoms that you have, how else might your animal be useful? For a lot of people dealing with social anxiety, we find that animals are incredibly effective in helping them to initiate conversations with people. I know around my own neighborhood, I know the names of the other dogs in the neighborhood better than I know the names of my neighbors. But because when I'm walking Mariska, my dog, I know Pretzel, the dog over there, or Bucky, the dog that's down the street. And it's so much easier to start those interactions. And I guess, you were talking earlier about hopelessness. Well, when I'm doing a suicide risk assessment, the two words I'm really looking out for are hopeless and helpless. So when a person's feeling like they have no control to make their life any better, and what our work with animals does is it helps us say, Well, you're not helpless in all scenarios. So if I can not be helpless in this one scenario, how can I generalize that to other areas of my life? So I feel like I'm totally a leaf blown in the wind, like I have nothing that I can do to overcome. Well, is that true all the time? When Mariska and I are out walking, I'm not helpless then. When I'm giving her chicken for her food, I'm not helpless then. So now I can build off of that.
When you think about an ESA and you think about ownership, there comes with expectations or ethics or things that you need to really consider to be a good owner. What do you guys coach or advise on to make sure that everyone's treated well and that this is a service that's well respected and that everyone's well in the process?
Yeah, we really want to think about, is this going to be a sustainable pairing? And so, first of all, what's just even the environment that I live in? If I'm in a dorm room, is it a good idea for me to have a St. Bernard? Is that going to be fair for the animal? Is it going to be good for my roommate? Is it going to be good for the other people who live on my floor? Because if it's not good for all of those connections, then the pairing might not end up being sustainable. And if I've made this bond, this connection of love, and now that gets separated for both me and the animal, I might have a sense of failure. Or can I even just afford the care and treatment of this animal at this stage of my life right now? So if any of those are, not really sure about that, then as a clinician, I might suggest, might we consider a lower maintenance pet? And again, knowing that research, that cats can even be more effective than dogs. But we've had, again, I wrote an emotional support animal for a turtle to be in a dorm room. So again, what's the level of energy and care that I can provide compared to what's the level of energy, care, financial resources that this animal needs? And again, how are the people who live around me going to feel about it? So I need to take all these things into consideration when thinking about a pairing. At Paws for Patrick, we never say no, but we might say not yet. Maybe this animal is not yet the right fit for you at this stage of your life. Yes, having a horse would be amazing, but having a horse in your dorm, not a good plan.
And people like me who we want to support and help, and we support by getting the word out, support by telling the clients who you guys are and what you stand for. What are more ways that people watching can support Paws for Patrick?
I think, again, spreading the word that it exists, and then also using the idea, there are a lot of people who have a negative view of emotional support animals right now because they feel like it's a way of manipulating. Oh, a person needs their emotional support animal, as if it's negative in some way. And the idea, we all need to normalize the fact that everyone has mental health, just like everyone has physical health. We would never, again, back to the analogy of exercise. If someone's like, oh, they want to go get in better shape, it's like, why would we mock that? So instead, when you're hearing people make negative comments about emotional support animals, realize that, normalize by saying, I had a great relationship with my pet when I was growing up. I really hope that helps that person. There are people who try to abuse the system, and they'll buy on Amazon a fake vest and they'll say, okay, I need to bring my emotional support animal into Target. The law says that you can only have your emotional support animal in your dwelling. So anybody who's taking their emotional support animal anywhere else, now again, there are certain bars, restaurants, stores that will let anyone bring their pet in. And so emotional support animals have access to those, but legally they only have access to a person's dwelling. And so if people are frustrated because they feel like, well, when I was growing up, you didn't see animals on airplanes. And yeah, you saw a lot of people who were getting really drunk or really high to get through a flight. If it helps a person to be more present, to be able to pet their animal, why do we have an issue with that? We don't complain. I mean, we may be annoyed if a person has a baby on a flight. We would never say, oh, that person has to bring their baby on the flight. So we have a lot of annoying things on airplanes at different times. But if that's helping that person to be present and to not have to use heavy medications to get through their flight, why do we have to be negative about that? So I think that's the biggest thing people can do. Spread the word, but also normalize that we all have mental health. We all benefit. Most of us really like animals and benefit from that connection. So why shouldn't we promote that?
Yeah. So just being really a supporter of the mission, supportive of the efforts and the actual results that you get from the ESA. Mm-hmm. Yeah. Well, I think that the most important note to end on is just the reality that mental health is a significant risk to people's life. And obviously this was found on Patrick's life, and ensuring that his life has meaning and purpose, and that we support Paws for Patrick in any way possible, whether it be spreading the word, good education about ESA, which is what we did today, donations or attending events. All those things are really helpful to make sure that you guys continue doing that good work, and people like Simply Bee can just benefit from just the good grace, the good faith that you guys come in. So we're so grateful for our partnership, and just want to say thanks so much for spending this time and helping us learn just a little bit more about what you guys do.
It's really our pleasure. And if people have questions, they can go to the Paws for Patrick website. They can go to Habri, Habri, to get more information about the impact of animals on mental health, and just reach out, because we're all fighting the same fight to make everyone just have a better mental health.
Yeah. Thanks, Dan.
Thanks.
Dan, one of the questions that I'm always curious about, and I'm still trying to learn because it is not always super clear. What's the difference between therapy, animal, ESA, and maybe something else that I don't know? What should we know? Like if we see a dog at Target, or if we see a dog on a plane, or just kind of curious about the differences, how would you educate kind of just anyone who's really unfamiliar with this?
Yeah, there is a lot of confusion, even in people who work in this area and have been for a long time. And at times the terms change. So Paws for Patrick, we specialize in emotional support animals. An emotional support animal is just a companion animal that shares a dwelling with its owner. And it doesn't need any kind of special training. Emotional support animals can be any kind of breed or any kind of animal. So it does, some people will say, well, can a Rottweiler, can this other kind of animal be? Yes, anything can be an emotional support animal, although there may be laws in certain towns that might say, we don't allow pit bulls in this town. But if you have an emotional support animal letter, the laws, and you're renting from a place that's covered by FHA, which is basically any place that has more than a couple of dwellings, and that they have to allow you to have, even if it's a walrus, whatever that thing is that a person wants to live with. Therapy animals, we typically think of dogs and horses. They have a higher level of training. The job of a therapy animal is to go out and to interact with people. And so they are focusing on not just the individual, but to like many people that they might be. So therapy dogs would come visit Simply Be, would visit other places. And so they have to be trained to be non-reactive. They have to not react to other animals that they see. They have to be comfortable. And the process of going out there, therapy dogs are generally only supposed to work 1 hour every other day because it can be taxing for them. A different kind of, similar to therapy dogs, are what they call facility dogs or facility animals, where they might work all day long, but they're staying at a single facility. So they might be able to, at a place like a hospital or whatnot, or Lake County Courthouse has facility animals that they might walk around, and it's less stressful for them because they're always in the same environment. They know what to expect. But so they might be able to work a little bit longer. So schools, Libertyville High School, Vernon Hills, they have facility dogs. The level of training that's required for them, it's going to take several months, and you're going to have to work with a specific trainer. There's nothing in the law that says exactly what that training has to be, but we at Paws for Patrick, Alliance for Therapy Dogs, certifies all of our animals. And they typically have to carry some insurance to make sure that if something were to happen when they were out on a visit, that they were covered. The highest level of training goes for service animals. A service animal is trained to respond to a specific symptom of a person. So if a person has sort of diabetes or epilepsy, and the dog may be trained to react if they're about to go into a seizure, or if their blood sugar is getting low. There are psychiatric service animals where if a person has an anxiety attack coming on, they can be trained to lick their face or do something to take them out of that state. Those animals usually take about $10,000 to $13,000 to train. And they are really specifically working only with that individual. So we'll get the question a lot where, if I have an ESA, could I get it trained to become a therapy dog and then maybe a service animal? Well, yes, you could get your ESA trained to become either one of those, but not both, because the training to become a therapy dog is to be focus outward on other people, whereas the training for that service animal is to focus just on your own client. So I hope that clears up a little bit of the misconceptions about least training to ESAs, then we have our therapy and facility animals, and then we have our service animals.
Got it. So if I have a kid, or for me, I feel like this is something that I need. If I have the financial ability to go buy or rescue, and they're my emotional support animal, would I do that, or would I go with Paws for Patrick? Like, when do I know which route to take?
So again, if we're thinking about an emotional support animal, then you might start with Paws for Patrick. If you're thinking that your animal, that you want to adopt an animal, but you know that you think you're going to eventually want to take it out and have it work as a therapy animal, you're really going to need to pay a lot of attention to the temperament of the animal. Because some animals they're never going to be well suited to being out in the public with lots of different people. So sometimes we will tell people, talk to even the shelter. The people at the shelter will know what is the hope of what this animal will do with you and with your family. Or you might want to work with a breeder in that kind of circumstance. So you'll notice that many therapy dogs, our labs, our golden retrievers, are the kind of breeds that tend to have a temperament that is better suited to being non-reactive and being kind of more friendly. So there can be great dogs that can make amazing emotional support animals, but they jump a lot, or they're highly reactive or excitable. So those might not make the best therapy animals. And for service animals, it is critically important, their temperament. Many service animals, there's an organization called Duo Dogs out of St. Louis, where they're training a lot of facility dogs, therapy dogs, but also service animals. And they breed them themselves for that purpose of having animals that are going to have the right kind of temperament. And so that's why pairing people with service dogs can take sometimes a couple of years to find the right organization to get that service animal trained up appropriately. And then they're doing a lot of training of the person who has the animal, because to know when your animal's working and not working and to send the right signals so that we are not confusing the animal is really, really important.
Do you help with the temperament part of it to see that there's a certain temperament that does fit what the person needs? Is that kind of the opportunity to using Paws for Patrick?
That wouldn't necessarily, Paws for Patrick, if that's a request that a person makes, then Paws for Patrick will partner with them on that. But that might be also something that they're working with their own clinician on, or if Paws for Patrick has paired them with a clinician. And as we're working through those things. Yes, I want a cat. Yes, I want a dog. Okay, well, what are you hoping that cat or dog is going to do? Now we're going to have that conversation about temperament.
Mm-hmm. Got it. Yeah, that's really helpful to make sure that you understand what the differences between where you source and get the animal is important, mm-hmm. like what each kind of area. And obviously, if someone has no idea where to start, you could send them to a more service dog facility. You might just refer out too. It sounds like you guys could just kind of be a portal for many different opportunities. It's not always what you guys have, but you'd refer out if needed.
Mm-hmm. And that's where, again, making those connections. I think a lot of people should consider fostering animals. So there's the foster to adopt model, and there's a number of organizations wherever you go. If you just look foster an animal, the nice thing is kind of like that rent to buy. But many of those animals may have come from backgrounds where they were abused, may have had some other issues. So they might be less well suited to those higher levels of therapy dog or service animal, but they might make a great ESA for you, a win-win.
Got it. Good to know.